Tonight, we have an update to a story we first told you about in March. An Arkadelphia woman who had both of her legs amputated after a horrific car crash is learning to walk again with new high-tech prosthetic legs. In tonight's Health Check report, a look at the remarkable progress she's made. Dr. Beth Wyatt, a former professor at Henderson State University, is used to doing the teaching. But over the past year and a half, she's been the one doing the learning. 1, 2, 3. Learning how to stand again, how to walk again, how to live a normal life again.
Stand up in my kitchen and cook. It's going to allow me to walk around my house and carry things, and it's going to allow me to stand up, which I've done, and hugged my husband eye to eye.
In July of 2022, Beth was in a multi-vehicle accident in Arkadelphia. Her car crashed into a ditch and burst into flames. She had 2 crushed legs, which doctors amputated twice, and severe burns all on the left side of her body. She lost her left eye, her spleen, and broke her back. On top of that, she had 2 brain bleeds, a concussion, and a broken hip. It's a miracle she survived. Her therapists believe it's her mental attitude more than anything that's helped her through this tragedy.
The fact that she is where she is right now, 15 months after bilateral amputations, is really astonishing, and that's her attitude is the #1 thing that I would attribute that to.
I think she's just one of the most motivated and determined people I've ever worked with in this job, and that's what's really helped her get to where she is.
Sarah Bunner is an occupational therapist at Baptist Health Rehabilitation Institute. She's working to help Beth meet goals that will help her in her everyday life.
If she wants to cook, if she wants to go hang out with her family and her grandbabies, how do we work on her mobility and her balance within those types of tasks?
While physical therapist Meredith McKelvey works with Beth on standing and walking with her new prosthetic legs that have microprocessor-controlled knees.
Hers are specifically power knees, and so when she leans forward and pushes up, they assist her in pushing up. So all microprocessors will stop you from falling, but the kind that she has also give her power assist to stand up.
So I'm learning balance, weight shifting, raising my leg to go up steps, walking, getting my gait right.
Beth is already doing well with her walker, but the goal is to move around without it.
So she can potentially and hopefully soon get to where she's not using a walker, a cane, anything, just she gets up and walks around the house like you or I do.
It's difficult, it's tiring, they're heavy, but just being there, upright. You get treated differently when you're in a chair. And I want to be back to what I'm used to.
Her therapists have no doubt she'll get there, but there's no real timeline. It's all up to Beth. And if we've learned anything about her, it's that she's definitely up for the challenge.
The chair, we can turn around and go back. Okay.